Welcome to Skincredible, where we tell you what you should know about your skin and how to glow. 'Cause your skin's incredible.
Hello, everybody, and welcome to another wonderful episode of the Skincredible Podcast. I'm your host, Dr. Lisa Swanson, and I'm here today with some very special people. These are Ben's parents, you guys. We have Jeff and Erinn in the house today to talk about their experience with their son, Ben, and eczema. Welcome, you guys. Thank you so much for doing this.
Yeah, thanks for having us.
Thank you.
I think Ben's story is so special and one of my favorites in my recent years of practice. And so when I embarked on this podcasting mission, I was like, we got to get Ben's family on this podcast because I think you guys have so much that you can share with families that are going to help so many people.
Yeah, it's been quite the journey for sure.
Right? Yes. Now, I first met you guys and Ben back in October 2022. So it's been hard to believe, but over 3 years.
Yep.
And at that point in time, Ben was 4 years old and he had been already struggling for a while with his eczema. Tell everybody what things were like for you guys and Ben up until we met each other.
Yeah, so even as, an infant at, 2-3 months, he had really dry skin and we were noticing that we had to put lotion on it every day. And he would get, blotchy patches. And then as he got a little older from, about 6 months to 2 or so, he would just have like little eczema patches like behind his knees or like behind his ears, hands and feet. Sometimes his eyes would get really dry. But other than that, his skin was pretty clear. He could go about day to day. Wasn't too itchy, wasn't very problematic. And then after he turned 2, he started having some other health issues where he wasn't really eating a lot. We found out he had a diagnosis called ARFID.
Tell me more about that, because you were talking to me about that earlier today, and I had not heard of that.
Yeah, so it's ARFID, Avoidant Restrictive Food Intake Disorder, and it's pretty broad. They kind of describe it as like an umbrella, and there's different categories under it. But for Ben, he really wasn't motivated by his own body to eat food.
I can't imagine that. I could take a little bit of ARFID myself.
Right.
If they're handing it out, I would take a little bit of that.
Just a little. Can I turn it down?
Right? Yeah.
He was just so picky eating. He lived off of shelf-stable chocolate milk we got at Costco for like 2 years. And it was just like the only thing he was comfortable eating, and he would have so much of it.
And he
also, how do they make milk shelf stable? Do you guys know the technology behind that?
I don't know. I will say I tasted it. Not very good.
Not good. Okay.
But he just had it in his head that this is what we need. Yeah. And, we bought it because there's Pediasure and other supplements. But, first ingredient's high fructose corn syrup.
Right.
Yeah. And so we looked, and realistically the nutrient balance, if we gave him a multivitamin and he had, he was at some points 5-6 chocolate milk boxes a day.
Oh my gosh.
And we spent probably like hundreds of dollars a month.
Easily.
Wow. Did the Costco people know you? Did they like get it ready for you?
We would fill a cart full.
Yeah. The whole bottom of our cart was just chocolate milk. That was it.
Wow.
And I think the other part was just the ritual of it. Like we tried regular chocolate milk and like out of a glass. And, it was his box, the way that it had a straw.
Yeah.
I think, really comfort and ritual. Yeah, so it's...
I'm kind of the same thing about peanut butter.
You got to get the same kind.
Yeah. And it always comforts me. And I love peanut butter so much. I could exist on peanut butter. Yeah. So you started noticing these symptoms of ARFID. His eczema was also kind of ramping up at that time.
Yeah.
Yeah, I think ADHD was also something we were thinking about. I have ADHD and he also had a lot of symptoms. And I think one thing that I want to mention also is like during this phase, we had Ben when I was 25, you were 23.
Yeah.
So like we were young parents in college when we had him, and he was our first, and like we just didn't know what was normal, what's not normal.
I mean, parenthood, even when everything goes smoothly, is pretty crazy and overwhelming. And then add some potential complications to the mix, and that's a lot.
Yeah, it's like, oh, are these rashes normal? And you just put some lotion on it, and it's like, oh, is it normal for it to last this long? We did our best research. We had a good, primary care physician.
Yeah, my mom is a NICU nurse.
Oh, wow.
So I reached out to her a lot. The amount of pictures I've sent of Ben's rashes. And,
yes.
Mom, is this normal? And going through all of this at the time when we're, about when he was 2, his food issues started. He started to show more anxiety about food. And then all of a sudden his eczema started getting worse. And as a kid, I had very small little patches, like sometimes inside my elbows and like on the backs of my hands. Yeah. But I never even needed to see a doctor for it.
Right.
So I recognized it. And Jeff's little sister actually has horrible eczema.
Oh, wow.
Especially as a kid.
Yeah.
Yep.
And I remember when we were either first dating or first married, they'd go to like urgent care in the middle of the night and go get stuff.
She's
so
16
itchy.
years younger than me, so
Yeah.
Oh, wow.
there's a big gap. So she was still a little kid when, well,
she was probably
like
six or seven,
yeah, around
and
there. 6, 7.
Yeah,
Cut,
6, 7.
Cut
You got
that.
yeah.
Cut that.
We're leaving it in because I think the more us older people say it, the quicker it is to die. Okay, so as eczema is getting worse, what did you guys try to do in those early days?
I mean, I don't even want to know how much we spent on different creams and how many hours I spent researching. And I was fortunate enough to be a stay-at-home mom, and so this was my job, trying to figure out what was going on. And for me, luckily, I didn't have to balance other things. So I went down all sorts of rabbit holes and contemplating trying to cut out dairy.
Can't do that.
No, not with his.
He needs his chocolate
literally
milk.
sustaining him. We joke about chocolate milk being the reason he's alive, but really, it really is.
Yeah.
And so cutting dairy out wasn't an option.
Filling the bathtub with oat milk.
Yeah.
All these like home remedies, store remedies, researching.
Right.
Yes.
The latest and greatest brands. And we used to have this basket of all the lotions, and they'd only be this much gone because we'd try something and it would make his skin red.
Yeah.
And it would make it worse, or it just didn't do anything.
And this is a 2 and 3-year-old with ADHD, right?
Yes.
Like it was not easy just getting him to stand still to put the lotion on.
Right.
Him.
We had to come up with very creative methods. One of our methods to get him to get lotion, we would sing Old MacDonald Had a Farm.
Oh.
And for the whole time it took to get him lotioned, and we'd be like a lion, a tiger.
Yeah.
He loved watching the show Daniel Tiger, where there's a trolley.
Yeah.
And he knew that trolley says ding ding.
Yeah.
So we added that into our song.
Yeah.
Made it fun. You made it fun.
We made it fun. He was squirmy, and down the road he did get diagnosed with ADHD, and he's also gotten diagnosed with autism. And so I'm thinking lotion is probably a sensory issue for him. He doesn't like how it feels. He doesn't like being greasy, doesn't like being sticky.
Yeah.
And as far as our trials of what lotions work best, it was Aquaphor.
Yeah.
And there's a CeraVe lotion that worked pretty well for a while. But both of those, they're thick, they're greasy. You have to wear long sleeves and long pants.
Yeah.
And, it just, for him, we finally found something that kind of worked a little bit. But, it didn't solve the problem. It didn't get to the root of the itchiness. It didn't get to the root of the redness. And he was getting progressively worse.
Yeah, and I remember like when it would get bad enough, like we'd go see a doctor, the primary care physician, and she would prescribe like oral steroids, and those would clear up really fast. Like it's amazing how fast those can like
work.
And it's like, oh, a miracle, but it's like you can't keep a kid on steroids.
No.
I mean, like behaviorally, he would become a rage monster.
Affectionately, he was a little rage monster, and he just could not control like anything, and he didn't want to be mad. Like he was so confused why he was reacting the way that he did.
But his skin was good for a few days, especially when it got really bad.
Yeah, that was right about right about his 3rd birthday is when we started doing the oral steroids more. And, we'd had a lot of changes in our life at that point. We were in a rental and we decided, hey, let's buy a house. And we said, okay, great. We decided to build. It's going to take 6 months. And we're like, man, we need to save some money.
Yeah.
And Jeff's parents were kind enough to let us live with them for about 6 months, and just being in a new environment. There was a cat. There were 2 more dogs.
Yeah.
There were
It's a lot of exposures.
Yes.
4 other people living in the house with us. We had a dog for about a year before Ben's eczema started getting worse. And so we didn't think dogs were the issue. Dogs were the cause. And now he's with these other animals and his skin is worse.
Yeah. You guys bring up so many important things. Studies have actually shown that kids that grow up in families and households with dogs actually have a lower than expected rate of eczema. So for most kids, having dogs is a little bit protective. And I am a huge fan of doggies. I mean, like, doggies just can do no wrong in my book. And so we feel good about families that have dogs in the home. The second thing you brought up that was so important is that kids with eczema have higher rates of ADHD and autism spectrum disorder. We know this. We don't completely understand it, although there have been studies, one study in particular, looking at this particular cytokine called IL-4, which is turned up in eczema. And they looked at the effect of excess IL-4 on the developing brain using mouse models. But they found things like delayed cognition, decreased myelination in the atmosphere of excess IL-4. And so that is an area of hot research, because we definitely see this association, and we're just beginning to touch the surface and understanding it. We also know that patients with autism spectrum disorder tend to have tactile sensitivities where they do not like the feeling of anything on their skin. And so most of the treatment for eczema up until the past few years has been topical. Yep. So talk about the struggle in using topical medications for a kid that hates anything topical, you know? So that's a big struggle. And I bet that was part of the reason your primary care doctor went to some of the oral steroids, because, oh, geez, these topicals aren't being tolerated really well. Let's treat it systemically. And as you guys observed so well, it works magically when you're on it. But then when you come off, the eczema, of course, often comes back worse. We call it rebound. Yes. Did you guys observe that?
Yeah.
Yeah, I think so.
I would say the first time the steroids worked really well. And I think he had a brief kind of respite, but not very long.
Yeah.
And then the next time we had to do the steroids, he just had a horrible reaction.
Yep.
He had
like
a reaction,
moody rage monster, or?
He had a skin reaction to it.
Oh, wow.
Oh, yeah, there was that.
So, yeah, there's in his chart, one of the steroids we tried, I can't remember which one, but ended up getting listed as an allergy.
Yeah, it was bad.
Wow.
We took it, and it was either within the first or second dose, and he had just, almost like red chicken pox looking all over his entire body.
Oh my gosh.
And it wasn't really hives, it was just these red spots. And so we had to try a different steroid to control that.
Oh my gosh.
And, he still had the eczema, and he was itching and
miserable.
miserable.
Yeah, I just remember, especially around between 3 and 4, he would scratch behind his ear so bad it would bleed. He'd wake, especially when I was sleeping, he'd just wake in the morning and he'd be covered in blood.
And his pillow was covered in blood.
And we'd try to keep socks around his hands, before he goes to bed. And using the steroids to get it clear enough, and then it would be okay for a while and it'd get bad again. And it was a bad cycle.
Yeah.
I have found that eczema not only affects the patient, but affects the whole family unit.
It does.
Yeah.
It puts a big strain on parent relationships with each other, marital discord and everything. And then it can have a huge impact on siblings too.
Interesting.
Because the eczema patient in the family demands so much time and energy that then sometimes the other kids in the family get jealous or just aren't getting the energy and attention that they need. What was your guys' family experience with that? Was Ben's eczema a burden for your family unit?
I would say one of the most challenging things, as I mentioned, I was a stay-at-home mom.
Yeah.
I spent probably hours of my day, Ben, don't scratch. Ben, sit on your hands. Ben, we need to put on some gloves. Ben, we need to stop. you're making yourself bleed. Let's go grab Band-Aids. Let's try some lotion. And just, he's sitting there, he's trying to play and he can't even play because he's so itchy. Yeah. And this was, about age 3 and 4 when that's their whole world was play.
Their whole world is play.
And, we'd try and sit and just watch a show. So at least his brain was stimulated and could stop scratching. Having ADHD too, he cannot resist the impulse to scratch. Right. It's there and it just has to happen.
Yeah, around this time, and Ben's eczema was near its worst. During the beginning of COVID, I was laid off. So when we talk about marital struggle, I was right on top of it financially, it's paying for these pretty expensive, specific eczema treatment lotions. Yeah. And it's can we afford it? I don't think it probably helped, right?
It's just one more thing.
One more thing to, add to the shelf. And
yes.
it was a very, very stressful time, and kids pick up on stress too.
I know.
There was tension. We were stressed.
Mm-hmm.
He was laid off for 8 months.
Oh, that's tough.
And, we are trying to entertain him and just, stay afloat.
Yeah. Meanwhile, you're quarantined because it's COVID time. So
we're all stuck inside.
Well, and they have even done studies looking at anxiety and depression levels and comparing the levels to parents of kids with eczema and comparing it to adults who they themselves have eczema. And the rates of anxiety and depression are greater in the parents of the kids.
That's really interesting.
Yeah.
I can see it though.
Yeah. Well, and scratching is one of those things you can't ignore it when especially when it's your child and they're scratching and they're uncomfortable.
Right.
And you hear it from the other room and you're like, stop scratching. I was at a conference once and it was a conference about itching and the impact of itch. Mm-hmm. And they played audio of people scratching. And it was like, oh my gosh. I was like, you got to turn that off. You got to turn that off now. It could drive you insane. Yeah. And here you guys are living with somebody that's just scratch.
Well, and all night long. And, we have a baby monitor in his room.
Yes.
And he wasn't comfortable when he was sleeping. He didn't sleep through the night for a long time. And flip-flopping around.
Yes.
Just lots of impacts at home.
Yeah.
And we were all mostly stuck at home together.
Right. Yeah. Those COVID days.
Right.
Well, then cut to October 2022. I meet you guys when you bring Ben in for an eczema evaluation. And, I looked back at my note from that day. And I noted just how bad the eczema was, the impact it was having on Ben and you guys, the previous treatments that had been tried, including the oral steroids and everything. And we had a discussion about a medicine called Dupixent, which had come out in 2017. And by the time I met Ben, I think it had recently been approved in the younger age groups.
Right.
The FDA takes a stepwise approach to these things. So it'll get approved down to 18 and then 12 and then 6. And now Dupixent's approved all the way down to the age of 6 months. Wow. But I think Ben was a candidate for Dupixent at that point in time. And so we talked about it that day. We decided to go ahead with it. What were your thoughts hearing about Dupixent? What were your fears? What were your questions?
I think we were willing to try anything.
At that point, our poor kid was so miserable and he's missing out on such vital times in his life. I was just thinking back to some of the things he had been missing out on. He couldn't play in a sprinkler.
Oh.
If he did, he would have a flare for 3 or 4 days. Yeah. And his whole body was just red and sore and itchy. He couldn't go outside and play in the grass. He had to have long sleeves and long pants. When we would take him to a park, I would have complete strangers come up to me. What's wrong with him? Is he okay? Oh, he has eczema. Have you tried this?
I know. Everybody has the magic thing, right? Yeah.
I get it. It's curiosity. It's natural. But at the same time, it's I am doing my best
I am trying.
As a mother. I promise you, I have tried everything that is physically possible for us to try. And so, when we heard about Dupixent, I was like, sign us up.
Yes.
If this helps him, absolutely. Of course, he was nervous about a shot because at that point, he had just barely turned 4 years old. And, already had been to a lot of doctors in his life, had some medical anxiety, and, no one wants a shot every month.
Right.
And we were a little anxious about that, but all of the benefits way outweighed, you know, oh, we have to get a shot every month.
Right.
It's like, okay, we'll make it work.
Yeah. Yeah. Well, and I think you guys had an accurate and good kind of feeling and representation of the burden that eczema was.
Right.
You knew at that point in time, like, this is no way to live. You know, like something has to change. We can't live like this and watch our son live through this.
Right.
Yes.
Yeah.
And I forget, when I mentioned it that day, had you guys already heard of it? There were commercials, I think, at that point in time.
I've seen commercials since.
Yeah.
But,
Yeah.
you know, I ignore most commercials most of the time anyway.
I know, right? Yeah. There are studies showing that we zone out a bit when those commercials come out. Yeah.
I had never heard of it before. You know, we'd seen his primary care doctor, who was lovely. She was so on top of things, and she's like, you know, this is the worst case of eczema I have seen in my entire career.
Yeah.
As a pediatrician.
Yeah.
And so she's like, hey, I know this pediatric dermatologist. And at the time, I think maybe still, you were the only one in like 250 miles.
400-mile radius
400 miles.
Yeah,
Oh my
around
gosh.
Boise, Idaho, still to this
So
day.
yeah, I didn't even know there were pediatric dermatologists at this point.
I know.
And, you know, there was some trouble just getting through the insurance, the referral process, and getting him in, even getting a phone call to get scheduled. And I reached back out after, you know, another failed steroid attempt, and I reached out to the pediatrician. I was, you know, almost in tears, like, please, can we figure out a way to get in? And they're like, we have this one receptionist. She is just, you know, she is aggressive and she will get you in.
Yeah.
And then within a week, we had a call from
Nice.
the clinic, and we were in. And so at that point, I was ready to do anything you said.
Yeah. You know, I gave our schedulers a list of things that, like, if this happens, if somebody calls and this is happening, I want to see that patient that week or as soon as possible.
Right.
And it's like, if something's bleeding, or if, you know, somebody has a fever, and if the parent is crying when they call, I want to see that child that week, you know? And so that day in October 2022, we went ahead and started Dupixent.
Right.
I think I even gave him the first shot that day in the office.
Yeah, we did it in the office.
And what was your experience in the days and weeks after that?
So we had a really unique experience.
Oh yeah, he had,
So he had his shot. We went home, and that night for a snack, we let Ben have those little sticks where you can dip into Nutella.
Yeah.
This little container.
They're delicious.
And he's
had them before.
Yeah.
It's like something that was fairly common to eat in our house. You were giving
I was giving a bath. Yeah.
And I was, you know, downstairs.
We had a newborn.
Yes, that's true. And, you know, Jeff says, Erinn, will you come look at Ben? And I said, okay. And I get up there. His mouth and face was swelling. Like, he started to get really red and blotchy. And I said, okay, buddy, we're going to get out of the tub. We're going to put on some jammies, and mommy's going to take you to the doctor right now, really fast.
We're going to have a little adventure to the emergency room.
Right. So, we, you know, I stayed really calm, and we got rushed right on back.
Yes.
And so they kept us overnight for observation. They took us downtown to the Children's Hospital, and shout out to St. Luke's, you know. We love St. Luke's.
St. Luke's Children's. It's a great little children's hospital.
It's such a great resource here in the Valley.
Yes.
And they, you know, they were great. And I said, look, we just started this medication.
Yeah.
And they said, this is not a reaction that should have happened. And, you know, I was terrified. I'm like, what if I gave my kid this shot?
Right. Yes.
You know, ended up harming him. And they're like, okay, take a picture, like, have your husband at home, take a picture of every label that he's eaten today.
Yeah.
We thought back, and we're like, well, he had Nutella, but he'd had it right before. So anyway, so we did initially have like a panic that he had this crazy allergic reaction. Luckily, it was just the hazelnuts.
Yeah. And not the Dupixent.
Right. Because I don't know what we would have done if we had to stop the Dupixent.
Yeah.
And, of course his skin got worse because he had a giant allergic reaction.
Sure. That's not going to help. Yeah.
But, even after with that first dose, it started improving.
Yeah. Yeah.
And like if he'd had that allergic reaction without the Dupixent,
Right.
his skin probably would have been a mess for months.
Yes.
Yeah.
Actually, that's true. That's a good point.
Because I have just the saddest pictures in the hospital, and
bet.
his skin is just red, dry, and flaky head to toe.
Oh,
Yeah.
And so, poor kid, but thank goodness for the Dupixent,
Yes.
and thank goodness that was not the cause of
Well-
the reaction.
well, and for the listeners and the watchers out there, so it is possible to have a reaction to Dupixent. It's very rare. It is possible. And of course, you'd stop the medicine if that were to happen. But reactions like this typically happen within 30 to 60 minutes of the exposure. And so when you guys, I think the hospital called me that
Yes.
night or the next day, and it's like, the timing is not right for it to be the Dupixent. I suspect the hazelnut. And so shoot, he can't have Nutella anymore.
Right.
Sad. Nutella's
Unfortunately,
delicious.
he can't have any nuts anymore.
Yeah, all tree nuts and
He-
peanuts.
He had a weird reaction to some like almonds and cashews. Luckily not anaphylactic.
And so once the hazelnut reaction
Yes.
settled down and we could kind of see the efficacy of the Dupixent, what was the first thing you noticed? Was it the skin clearing? Was it the itch getting better? Was it an improvement in his mood? Some families notice that.
Yeah, I mean, I feel like it kind of all happened at once for
Yeah.
us where, it just all of a sudden, like, this is a different kid.
Yeah.
We used
Yeah.
to have to shave his head all the time
Yes.
because he just any kind of allergen or irritant getting in his hair, his scalp
Yeah,
was
he
like
would scratch
raw.
it, and then it would, scab, and then he'd have scabs all throughout his hair, so
And
we'd
so,
keep it really short.
we noticed he could grow his hair longer. He
Yeah.
wasn't itching. His skin was clear. We weren't getting comments anymore from strangers.
Yeah.
And he started to look like just a normal kid
Yeah.
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 and act like a normal kid.
Yeah. Isn't that amazing?
Yeah.
Kind of seeing that transformation.
Right.
I've had parents tell me, sometimes it feels like they're meeting their kid for the first time,
Right.
because finally they're kind of untethered by the burden of
Yeah.
eczema and they're allowed to just be a kid and be themselves.
Yeah, I
you
did
know?
notice that he wanted to play more. And
Aw.
before, I was pregnant, I was sick, but we watched a lot of TV because he didn't feel good.
Yeah.
Yep.
I can't
Yeah.
imagine, I have like a little eczema patch on my hand and it like preoccupies me.
Yes.
I can't imagine having that be my whole body. I don't have the language to explain what's going on.
Yeah.
And it's been my experience. That's just all I know.
Yeah.
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 And so to have that lift for him
yeah.
and he's able to just be a kid. He wanted to play. He's like, let's set up an obstacle course, let's play with
Aw.
magnets. Let's do this. Let's do that.
I love it.
And he just was happy.
Yeah. As an aside, Obstacle Course is one of the best episodes of Bluey ever. Do you
Yes.
guys watch Bluey?
We
Oh,
love
yeah.
Bluey.
Oh my gosh. That is one of my all-time favorites.
Yes.
Love, love, love.
Bluey's big in our house.
Oh my gosh, I can't get enough of it. And so things are improving for Ben. Things are probably improving for you guys as a
Yeah.
family. That sense of kind of dread and anxiety about living with eczema.
Right.
You're starting to shed those scales and
Right.
and life is good.
Yeah.
And then a year later, so in October 2022, when we started him on Dupixent, your guys' insurance covered it great.
Right.
Everything was super duper. And then about 9 months after that, the insurance company decided that they weren't going to cover Dupixent anymore, period, for anything,
Right.
which is shocking, wrong, in my opinion.
Oh, yeah.
Yep.
To eliminate a medicine that has such a profound reach to help people with a
Right.
variety of conditions. It's indicated for so many things. To take that away from all people, it should be illegal in my
Right.
mind. And so when Ben's prescription came up for renewal, I thought, this will be okay. Dupixent is the only medicine, even to this day, is the
Right.
only systemic medicine that's approved under the age of 12. And he was an established patient on an established therapy that they had approved a year prior. And I thought for sure this will just be okay.
Right.
Well, they denied it.
Yes.
And this particular insurance company, whenever I think about this insurance company, I think of Frau Fabissina from Austin Powers, because she was the founder of the militant wing of the Salvation Army, which I think was then rebranded as this particular insurance company.
Oh my goodness.
Because they've always been just trouble, but this Dupixent stuff was really a next level.
Right.
And so I thought when they denied it, like, oh, they just don't understand. They don't realize that this is continuation of therapy that's been effective and well tolerated, and they don't understand Ben's age. And I just need to schedule a peer-to-peer to explain it to them.
Right.
And so I did that. And I was on the phone with a pharmacist from the insurance company. And the pharmacist told me that we needed to stop Ben's Dupixent and instead put him on a systemic immunosuppressant like methotrexate or cyclosporin for 3 months. And then we could re-appeal. And my head was about to explode.
That kid's been through so much
so
already.
Much.
And yeah, we had such a great last several months.
Yes.
Right.
Yes.
It was a year. It was a whole year.
years.
And I remember finding out about the denial, and I was just in shock.
Yeah. You're going to take this away from this kid and this family.
It's
for no good reason.
Miracle medicine.
And we've talked about like itching, torture for the kid, torture for the poor kid.
Right.
Yes.
So to say torture this kid again for 3 months or whatever.
Yeah.
Just for the heck of it.
Just for the heck of it.
And
these systemic immunosuppressants they wanted me to prescribe, of course, they're riddled with side effects that we used to use back when we had no choice. And they require blood draws, and they increase infection risk and can be associated with kidney problems and liver problems and all of these things. And here we have Dupixent, so safe, so effective, established therapy, and they want me to get him off of that. And so I don't know if I ever shared with you guys the details of what I told this pharmacist.
I'm looking forward to it.
But I printed it out because I immediately after the conversation, I wrote it all down.
Yeah.
Because I was actually pretty impressed with how I maintained my composure. Because I was just like, if you could see my face as I'm on the phone with this person, I was going I was what'd you call it? Rage monster. I was a little bit rage monstery. And I was like, Lisa, do it classy, maintain your composure. And I was pretty proud of what I said in that moment because sometimes, that adrenaline gets pumping and, you
almost blackout.
Right. Yeah. It's like blackout mode. And so I was pretty proud of what I said. And so when I hung up the phone, I wrote it all down because I give a lot of talks. And so I've actually shared this in lectures to help other clinicians, other families who are dealing with similar things. So this is what I said. To clarify, you are asking me to discontinue an effective FDA-approved therapy for a 5-year-old and switch him to a non-FDA-approved systemic immunosuppressant that comes with serious potential side effects and toxicities. I just want to make sure that's what you're asking me to do. I want to be clear that that's what you're asking me to do. I feel like this course of action would violate the Hippocratic Oath to do no harm, which is something that we doctors all take.
Right.
This conversation is making me uncomfortable because I feel like what you are asking me to do is unethical and not in my patient's best interest. Talking about this is making my stomach hurt, which was true. I do not think that systemic immunosuppressants are appropriate for my patient. By requiring me to prescribe these therapies, you are making medical decisions. And by taking over as medical decision maker, you are liable for any adverse events that occur as a result of forcing me to prescribe these therapies. I refuse to take responsibility for medical decisions that are not my own. I will be documenting this conversation in the patient's chart. So I wanted to ask your name. I documented his name. Because I want to make sure to establish a legal trail of the interactions impacting this patient's care decisions. So,
mic drop.
Yeah, mic drop. And so when I hung up with this gentleman, he was sticking to it. I needed to stop the Dupixent. We needed to switch to systemic immunosuppressant. But 10 minutes later, I get a phone call from his manager saying, I apologize. We've reviewed this. We made a mistake. The Dupixent will be covered. Hallelujah. So we gave you guys the good news. He's still on Dupixent to this day.
Yep.
And the insurance company has not given us grief about it.
No, they have not.
Even though their policies have not changed, they have not given us grief about it.
Right.
And so I feel very vindicated by that, which is Good. Very good.
Yes.
So that was like fall 2023 that we dealt with
Right.
this. Here we are in early 2026. How's Ben's life been over the past couple of years?
You know, he's been great, and we are so grateful that you went to bat for us and for him. I don't know what we'd do without this medication.
Right?
I really forget that he has eczema at this point.
Yes.
Like, he can do whatever he wants. He can play. He can, play in mud. He can roll around. He can play in the sprinklers, and his skin is fine.
Yeah.
It gets a little dry.
Still a
and,
sensitive side.
Yeah.
we use, the Erinn regimen.
Yeah.
And, the only issue we've had with the Dupixent is he's had some just dry eyes. But, we saw an eye doctor. We got some drops.
Mhm.
We found a spray because he didn't like the drop.
Yep.
But he hasn't had an issue with that for probably a year and a half.
That's great. And to the listener, conjunctivitis or a red or pink eye
Right.
happens in about 10% of patients on Dupixent. It tends to come and go. It's not typically a big deal. Usually some drops help immensely. Yes. Yeah. Yeah. And so, the SHOTs,
Yes.
as I like to call it, of Dupixent, they hurt.
Yeah, they're not nice.
They're not great. I mean, sometimes they say if you could create the perfect medicine in a lab, it would be Dupixent. So effective, so safe.
Right.
The only downside is the ouch factor.
Right.
Yes.
Those shots are rough.
They hurt.
We're lucky my mom's a nurse, and she recently has moved, but she used to live close by, and so, every month she would come over and she would do the shot for us, and we're comfortable doing it, but it was better to have grandma.
Yes.
And so, if she's ever in town when it's
Yeah.
time to do it, she's like, I'll do it.
I'll do it.
Yeah, it's a big one. I took Ben to he got a flu shot at a recent checkup, and
He probably sailed through that.
he was so nervous, of course, right? He's
Aw.
just like, okay, really preparing, really got super anxious about
Yeah.
it. And then the nurse, boop, like done
Yeah.
in a half a second, he's like, wait,
Oh,
what?
yeah.
This is nothing.
That's nothing.
He's like, oh, I wish my Dupixents were like.
I know. And I
But,
wish
yeah.
they were too. I
Oh,
know.
and it's so much liquid in
It
there.
is, so much-
and
the
the needles are
volume.
big. I mean, it sucks, but every
Life
time.
changing.
Yeah.
It was life
Yeah.
changing for him, life changing for us. Like, it's a small price
Well,
to
and
pay.
every
Uh,
time he gets it, I'm like, buddy, you don't even remember how itchy you used
I
to be
I know.
anymore.
Yeah.
You don't know life as it used to be for you.
We've shown pictures to him,
And he doesn't-
like,
He can't even fathom that. He's
Sometimes
bloody and
sometimes I do the same thing because the kids, they forget.
right,
And so sometimes I will show them
right.
previous photos, like you used to live this way, But yeah, I wish I could make the shot less ouchy. Now that Grandma's moved away, who is in charge?
We've got a pretty good system. Even when Grandma was here, he'd sit on my lap.
Yep.
We have a bar
be
stool.
restrained.
Yeah. Gentle restraint.
Just with his autism and
Yeah.
ADHD, his emotions can just go from 0 to 100.
Yeah. Yeah.
And this is a thing to be,
Yeah.
anxious about. It's a nasty shot.
It is.
But
Yeah.
every time we sit there and we do our little, buddy, you're so brave. You can do this. This is going to make your skin so much better.
Dum-dum afterwards.
Yeah. A little
Popsicle,
treat, a little
sucker,
prize.
let him hold a stuffy, watch a show, whatever we need to do to get it done.
Everything.
Yeah.
Now he sits on my lap and Dad gives the shot.
Yeah.
Still a little squeamish around needles. And
Of
I'm like,
course.
I know I could do it, but
Yeah.
we'll let Dad do the
Yeah.
shot. I'll hold him, and now we're at the point where he does keep his legs pretty still, and I just have to hold his arms to make sure he doesn't try to stop
Yeah. Sometimes
it.
you just react. You don't want to, but
Right.
yeah.
And
yeah.
I think that's, I think he can calm down and realize I need this.
Yes.
But it sucks.
Yeah.
I wish he could. Like, he's always so tense, and I'm sure that just makes it worse.
hurt
so much
worse.
work.
You gotta do it. And,
Yeah.
And it's so worth it.
And
yeah.
I heard that Ben wrote a story for his class
Yes.
Yes.
about how brave he is when he gets his shot.
Yes. Yeah. He had a little, just like a reflection assignment. I think it was about his summer trip last year in school. And we'd gone to the Oregon coast, and the day before we left, we said, oh, hey, we need to do this before we leave. And that had stuck in his mind about how brave he was, to the point at the end of summer, a month or two later, he wrote about, how brave he is. And he talks about it. Well, I'm brave because I get my shot. And, his teacher was like, what are you talking about? So, I had to reach out. I was like, well, he gets the shot for eczema.
Yeah.
It's such a part of him now and his routine the whole time. Buddy, you're so brave. You can do this. You're strong. And he's internalized how brave he is.
Yes.
Because he does. He has to get a shot every month, and most kids don't.
Right.
Most kids get their flu shot once a year.
And that's
golden.
It.
Yeah. And the flu shots are nothing compared to this.
I know. Yeah.
There's such confidence now.
Oh, do you still have the book?
I don't know if I have the book, but I have the picture.
Oh, I would save that forever.
Oh yeah, I took a picture right when I saw it, hanging up in the hallway, and I was like, oh, gotta take a picture of this, gotta send it to my mom. And
I love it. Would you guys have any words of wisdom to families out there, doctors out there who are managing eczema, who are at a point where their frustration level is high, the discomfort level is high, they're thinking about Dupixent for their kiddo? What are your thoughts? Feelings? Just do it.
It's so amazing for him. It truly has been a miracle for our family. And, it sucks. It's a shot. Kids don't like it. You don't like giving it. You don't like, if you have to go to a doctor's office to give it, it can be inconvenient, but it's so worth it. I mean, genuine.
Yeah.
I forget that he has eczema.
Yeah.
He doesn't have issues day to day.
Yeah. Which is freeing.
He can do whatever he wants now.
Yeah.
And we were in the trenches. It was years before we finally were able to get into a dermatologist, find a good dermatologist, find a pediatric dermatologist if you can.
Yeah.
And, listen to what they are telling you.
Yeah.
And sometimes the creams just aren't enough.
Right.
You can cut things out of your diet. You can try everything, and it just might not work.
Well, and for some of the kids with tactile sensitivities, the shot is actually easier.
Right.
Yes.
It's a one and done.
It's a one and done. The daily battle of applying creams is just a nightmare. And so sometimes the battle once a month to get the shot done is easier,
We even tried the wet wraps with him. And, oh my gosh.
I know.
That was very short-lived.
Did we do that once?
Yeah.
It was maybe a week.
That was a one and done.
And we were so desperate for anything that would work, and we hadn't heard of Dupixent before.
Yeah.
Now that we have, it's like, I will preach it from the rooftop.
Yes. I love that so much.
I think my advice would be stand up for what you need medically.
Yes.
Doctors, stand up for your patients.
Yes.
Insurance companies are insurance companies. And sometimes I think what Dr. Swanson did for us, just so amazing. We're so grateful to her. Yeah, it's your body, it's your kid's body, it's your patient, whoever it is, and stand up. It makes a huge lasting impact.
Yeah. I think part of the reason I do it is I'm very stubborn. My stubbornness helps me because I'm like, you're not going to tell me what to, what to do. I know it's right for my patient and I'm going to fight for it. And so I'm happy. In fact, there's a part of me that looks forward to the battles, you know, because I know I'm on the good side.
Yeah.
And,
right.
Yeah. Good versus evil. Good always wins.
But it just blows my mind. Every time it's just whatever it is, insurance company denies something. It's just why are you arguing with a doctor about it?
Yeah.
I know. I know. It's crazy. And, a lot of those denials are just automatic denials because they know a lot of people will give up and move on or do something else.
It's horrible.
I know. And I'm sure they have statistics showing that this percentage of time, doctors don't take it past the initial request.
Right.
And so I think that's another part of it for me. I want their data to show that there are doctors out there that will fight for what is right to make sure patients get the medicine that's best for them. Well, thank you guys so much for doing this. I know life is busy and I appreciate you so much taking this time talking to me. Ben is camera shy.
Yes.
And didn't want to appear on camera, but we do have pictures
Yes,
Yes.
of Mr. Ben that we can include and kind of embed in the content so the audience can see just what a cutie he
absolutely.
is. And so thank you guys who are listening. We appreciate it so much. Keep tuning in to Skincredible Podcast. Please like and subscribe, and we'll keep the great content coming. Thanks, everybody.